In this video, you're going to learn all about sleep in menopause. In more detail, here's what you can expect to cover. First, we'll talk about the prevalence of sleep problems in menopause. That is both insomnia as well as sleep apnea. Then we'll talk about what causes the lack of sleep in menopause. Is it one cause? Is it multiple causes? And so on. And finally, we'll talk about the solution. What can you do to help you sleep in menopause, both from a perspective of supplementation, as well as exercise, nutrition, and one behavioral intervention is the most powerful of them all. So before we jump in, who am I? My name is Igor. I'm the author of the book, Mastering Menopause, Science-Based Menopause Diet, Exercise, and Supplements for Women. If you want to buy it on Amazon, the link is in the description below. As well, I'm the CEO of a premier personal training company that specializes in women's health, especially women over 40. It's called Fitness Solutions Plus. I've also been a personal trainer since 2006, and I've done over 400 wellness presentations for some of Canada's largest corporations, including the University of Toronto, IBM, Bosch, American Express, Investors Group, and others. Before we jump in, if you want to learn when I publish more videos about exercise, nutrition, menopause, and women's health, click like and subscribe to my YouTube channel. Now, let's discuss the prevalence of sleep problems in menopause. Here's one study titled Prevalence of Insomnia and its Relationship to Menopausal Status in Middle-Aged Korean Women. In this study, it showed that premenopausal women, that is women who are still getting their periods on a regular basis, about 6% of them experience insomnia. For perimenopausal women, that is women who are still getting their periods but are getting close to menopause, their periods are becoming irregular. Approximately 15% of them have insomnia. And in postmenopausal women, almost 20% of them get insomnia. And that's just this study. Another study shows different prevalence. Here's a study titled Climacteric Complaints in the Community. Premenopausal women, perimenopausal, and postmenopausal women all have approximately the same prevalence of insomnia. Now, that's just insomnia. What about sleep apnea? Here's a study that looks at that. It's titled A Portrait of Obstructive Sleep Apnea Risk Factors in over 27,000 middle-aged and older adults in the Canadian Longitudinal Study on Aging. Yes, that's a mouthful. So premenopausal women, about 7% of them have sleep apnea, whereas 14% of postmenopausal women have sleep apnea. So neither one is a very high amount, but really, if you're watching this video, you're probably having problems with your sleep. So you don't care what the prevalence is. You know that you are having issues and you want to know the solution. So we'll talk about that in a few minutes. And so what's the reason behind sleep apnea? Well, one is drops in estrogen and progesterone decrease the tone of the muscles that open up the airway. Sleep apnea is when the muscles kind of collapse inwards and you stop breathing for a few seconds and then it opens up again when you wake up. That's one reason. The other reason is that increased waist circumference. Very often, women's waist circumference increases during menopause, especially with a shift in body fat from the buns and thighs up to the waist. And so these are the two biggest reasons why sleep apnea may become more prevalent after menopause. Now, what causes the lack of sleep in menopause? Well, here is a study titled The Interplay Among Natural Menopause, Insomnia, and Cognitive Health. So the three biggest reasons for poor sleep in and after menopause are 1, hot flashes, 2, bad mood, and 3, night sweats. Now, here is something that's not really clear, however. We know that only a minority of women experience sleep problems in menopause. So all women lose estrogen during menopause, but only some of them experience insomnia. Why is that? Why do the majority have no problem sleeping, and yet the minority, probably you, because you're watching this video, why do the minority experience insomnia? That part isn't quite clear yet. Now, rather than talking more about the problem, let's talk about the solution. So what can help you sleep in menopause and after menopause? Well, the most common go-to solution is probably melatonin, but does it really work? Well, here's one study titled The Effect of Melatonin Treatment on Postural Stability, Muscle Strength, and Quality of Life and Sleep in Postmenopausal Women. Here's what they did. What they found, well, here's rather what they found. They found minor improvements in sleep in postmenopausal women that were supplementing with melatonin. So it wasn't particularly impressive. Lots of women take melatonin and it doesn't really help their sleep. Here's another study on melatonin titled agomelatine, which is a type of melatonin, a potential multi-target treatment alternative for insomnia, depression, and osteoporosis in postmenopausal women. And here's what they found. In menopausal women, this worked in about 35% of menopausal women, but it worked really well in younger women. So again, it's not that effective in the majority of menopausal women and postmenopausal women. Now, here is a better approach to sleep resolution. It's called CBTI. That stands for Cognitive Behavioral Therapy for Insomnia. So in this study, here's what happened. There were 46 both postmenopausal women with insomnia, and they were divided into an intervention group and a control group. The intervention group received CBTI, that's Cognitive Behavioral Therapy for Insomnia, one more time. And what that entailed is they had 6 weekly sessions and a 4-week follow-up. And I'll get into what CBTI entails in a few minutes. The other group was a control group. They did nothing. And here's what happened at the end of this study. The minutes spent trying to fall asleep before CBTI was 90 minutes. After CBTI, dropped down to just under 20 minutes, about 18 minutes or so. That's in the CBTI group. In the control group, they went from 90 minutes as well, down to about 60 minutes. So still, it takes them an hour to fall asleep, and that's a very, very long time. And what about the hours spent asleep? Not just hours in bed, but hours asleep. The CBTI group went from 5 hours of sleep up to 7 hours of sleep. So they got pretty good rest. Whereas the control group went from 5 and it stayed at 5. Their hours of sleep didn't change. Now, what about the quality of sleep? How restful was it? Here is what happened before. The CBTI group, about 70% of them, or almost 80% of them, rated their sleep badly, either bad or very bad. Whereas the control group, same thing. About the same number of them rated their sleep as bad or very bad. Here's what happened after the study. The CBTI group, now 80% of them rated their sleep as good or very good or excellent, okay? Which means only a minority at this point rated it bad or very bad. And for the control group, well, a bunch of them still rated it, about almost 50% of them still rated it pretty badly. And so CBTI can be quite powerful, and there are different ways to administer it. Here is another study titled Treating Insomnia Improves Depression, Maladaptive Thinking, and Hyperarousal in Postmenopausal Women. And so it compared CBTI to other forms of methods for improving sleep. So it compared it to medications, and it was more effective. It compared it to specific class of drugs called hypnotics, compared it to yoga, lifting weights, as well as other supplements. And in all those, CBTI was more effective than any of them. In fact, CBTI is the primary method of intervention for chronic insomnia, according to the American College of Physicians. For them to adopt a therapy and take this kind of stance, it has to show incredible evidence, and it does show, indeed, incredible evidence. So there seems to be a lot of effectiveness to CBTI beyond supplements, beyond exercise, yoga, mindfulness, etc. Not only that, when you stop the medications, or you stop the supplements, your insomnia returns. That's not the case with CBTI. Once you've learned the behaviors, thoughts, emotional patterns that help you with your insomnia, that the change is semi-permanent. You don't need to keep doing it over and over and over again to maintain the changes that you've done. If you want to learn more about CBTI, there are a few resources you can go to. There's a fantastic book. It's called Sink into Sleep by Judith Davidson. A link to that is in the description below. There are also different apps out there. I don't want to name any specific app in case this app is no longer around at the time you're watching this video. There is also group coaching for CBTI. And lastly, there is one-on-one coaching. Now, this video is just about sleep and menopause. If you want to learn about the other symptoms of menopause, I have a special video about that on your screen right now and in the description below.